The purpose of this project is to show and explain the scheduled implementation of an electronic health record using Microsoft Project. In order to successfully implement the electronic health record in our not-for-profit hospital, the following tasks and their respective predecessors had to be planned for and completed according to the schedule. We included a patient information management system, a clinical information management system, laboratory, pharmacy, radiology, imaging, and nutrition and food services. Once we determined our high-level tasks, we calculated their total duration and schedule and mapped these out based on the various levels of implementation and training that would need to occur for each component of our EHR. For this project, the total duration was calculated to last 155 days, and the entire implementation was scheduled from July 10, 2007 to February 11, 2008. For each of our high-level tasks, there were various subtasks listed that must be completed for each component of the EHR. For example, on this slide you will notice that in order for patient information management to be completed, the subtasks of patient registration, patient scheduling, and admission, discharge, and transfer had to be completed as well. We have highlighted the various high-level tasks and subtasks on the following slides to illustrate the timeline for the individual components of this project. We've included our laboratory subtasks, our radiology subtasks, our nutrition and food service subtasks, our pharmacy subtasks, our imaging, and our clinical information systems subtasks. In order to see the effect of a change in the scheduled implementation, we ran a test to see how the completion of one subtask would alter the outcome of our total project. We adjusted the project timeline, assuming that the configuration of the admission, discharge, and training component of the system could be completed ahead of schedule. Rather than taking the 30 days that was allotted for the initial configuration, we changed the duration to 20 days. By decreasing the duration of this one subtask, we were able to show that the expected end date of the total project implementation could be moved up 10 business days as well. As a result, the total project duration decreased from 155 days to 145 days. On this slide, you will see the original timeline for the patient information management component of our EHR and the various subtasks that had to be completed for this component. On this slide, you will see the effect on the timeline of completing this configuration of the admission, discharge, and training component ahead of schedule. As you can see, completing this subtask and the patient information management task early also moved up the start and finish dates for the subsequent configuration and training sessions planned for the other components of our system. It was evident completing this project that there are many benefits to using a project management tool like Microsoft Project. The tool can be used by an organization to facilitate strategic planning for a major project like the implementation of an electronic health record. It is useful for planning in terms of determining the most efficient and cost-effective ways to roll out the configuration and training of the various components, and for budgeting for staff and other resources over the course of the project. Having such a tool is particularly effective when planning a project that has many high-level tasks that also require many subtasks and that are reliant on completion of one component to begin the next. As we saw in our test, the entire project plan can change drastically even if one small subtask goes wrong or is completed ahead of schedule. This has major implications, particularly from the financial and human resources perspectives. Finally, a project like this one requires a large team of both technical and operational professionals. Therefore, it is useful to have one clear plan that can be understood and accessible to all members of the implementation team. In addition to discovering the benefits of a tool like Microsoft Project, we gained a greater understanding of the complexity of project management. When planning for a major organizational project, it is critical to understand the details of the project and how the various components should be managed and executed to achieve the desired outcome.